If you're over 60, here's a question that could save your life. What would you do if a brain stroke struck when you were all alone? Every year, over 13 million people worldwide experience a stroke. According to the World Health Organization, WHO, stroke is the second leading cause of death globally and the main cause of long-term disability in adults over 60. The difference between life and death often comes down to what you do in the first 10 minutes. Here we're going to discuss 7 smart life-saving tips which help to survive a brain stroke alone after 50. Before we begin, write your age and location in the comments. It helps us understand who's watching and what kind of health advice can serve you best. And if you care about your health and want to learn how to protect your brain, please like this video and subscribe. It tells YouTube that our research is helping people like you. This video is based on updated medical research from the American Stroke Association, Harvard Health, and leading neurologists such as Dr. Ralph Sacco from the University of Miami. Let's start with the first life-saving tip every senior must know. Number 1. Recognize the symptoms. Fast and visualize your weak part. When a stroke hits, every second counts. The faster you recognize what's happening, the greater your chances of survival and recovery. Doctors use the acronym FAST, F, face. Check if one side of your face droops when you smile. A, arm, raise both arms. Does one drift downward? S, speech. Is your speech slurred or strange? T, time. If yes to any of these, it's time to call for help immediately. According to Dr. Mitchell Elkin, former president of the American Heart Association, nearly half of stroke victims delay getting help because they don't recognize these warning signs. If you're alone, here's an extra step most people don't know. Try to visualize which side feels weak or heavy. This mental focus can help your brain create emergency connections between neurons, slowing damage, a concept backed by studies in neuroplasticity from the National Institutes of Health, NIH. And remember this, if your face feels uneven, your arm feels heavy, or your words sound wrong, don't wait it out. Act fast. Number 2, call for help. Dial 911 first. Even if you can barely move or speak, call 911 immediately before doing anything else. Research from the Centers for Disease Control and Prevention, CDC, shows that stroke patients who reach the hospital within 1 hour are twice as likely to recover without permanent disability. If speech is hard, use voice commands on your phone. On most smartphones, say, "Hey Siri, call 911," or "Okay Google, call emergency services." If you can't speak clearly, try tapping the phone screen. Even one word like stroke or heavy breathing sounds may alert the operator. Keep your emergency contacts saved under ICE in case of emergency. Many paramedics are trained to check for it. And if your phone is out of reach, use your non-paralyzed hand or foot to push or knock something over. Make noise. Draw attention. People nearby might hear and call for you. Remember, don't waste time calling family or friends first. Doctors like Dr. Stephen Kramer, a neurologist at UC Irvine, emphasize that every minute of delay can cost 1.9 million brain cells. So your second step is clear. 911 first, everything else second. Number 3, note the time of onset. The moment you first notice stroke symptoms, look at the clock or your phone. Remember that time. Write it down if you can. Why? Because doctors can only use clot-busting medication, TPA, within 3 to 4.5 hours after symptoms begin. This treatment, called tissue plasminogen activator, can literally dissolve the clot and save your brain. But if you don't know when the symptoms started, doctors may have to skip this life-saving option. According to the American Stroke Association, patients who receive TPA in time are 30% more likely to recover with little or no disability. Yet many people lose this chance because they forget or can't recall the onset time. So even if you're weak or dizzy, say it out loud. Something like, "It's 2:45 p.m. I feel numbness on my right side." That verbal note could help rescuers document the event correctly. If you can, use your phone's voice recorder or send a text to yourself. It doesn't have to be perfect. Just a timestamp matters. In stroke care, time is brain. Every minute counts. As Dr. Jeffrey Saver from UCLA Stroke Center explains, each minute a stroke goes untreated, a person loses about 1.9 million neurons. So your third life-saving move, record the time. It could mean the difference between walking again or not. Number 4, breathe exactly like this. In for 7, hold 7, out for 7. Panic makes things worse. When you panic, your blood pressure spikes and your brain gets less oxygen. That's why your breathing becomes your next tool for survival. Here's what neurologists recommend. A proven pattern used in stroke recovery therapy and meditation research at Harvard Medical School. Breathe in slowly through your nose for 7 seconds. Hold your breath for 7 seconds. Exhale gently through your mouth for 7 seconds. Repeat this cycle at least 5 times. This breathing rhythm activates your vagus nerve, which helps calm your heart rate, stabilize blood pressure, and improve oxygen flow to your brain. According to Dr. Herbert Benson, founder of the Benson Henry Institute for Mind-Body Medicine, slow rhythmic breathing can trigger what he called the relaxation response, the opposite of panic mode. If your speech is slurred or one side is paralyzed, focus on the breath alone. Picture each inhale as oxygen reaching your brain and each exhale as stress leaving your body. You're not trying to fix the stroke. You're buying your brain more time until help arrives. Remember, calm mind, steady breath, stronger survival. Number 5, unlock doors and move to a visible area. If you can still move, this step is crucial. Paramedics can't help if they can't reach you. So unlock your front door immediately. If you live in an apartment, unlock the main gate too, or leave a door slightly open. This small action can save rescuers precious minutes. A study published in the Journal of Emergency Medical Services, GEMS, reported that door delays cost an average of 3 to 5 minutes in emergency response time, enough to worsen brain damage during a stroke. Next, move to a visible or central area, like your living room or hallway, where rescuers can find you quickly. If possible, keep your phone beside you and lie where you can be easily spotted through a window or open curtain. If you live alone, this is a good reason to install a smart lock or medical alert system. Devices like Life Alert or Apple Watch Emergency SOS have helped thousands of seniors get help fast. And remember, every action you take before help arrives increases your chance of recovery. You don't need to be perfect. You just need to keep yourself findable. Number 6, lie on your left side with your head up. Once you've called for help and unlocked the door, your next priority is to protect your brain and airway. Lie on your left side with your head slightly elevated, around 30 degrees if possible. This position helps your blood flow more evenly and prevents choking if you vomit or have trouble swallowing. Why the left side? Studies in neurology and emergency medicine show that this posture reduces pressure on the brain and helps keep the airway clear. According to Dr. Patrick Lyden, a leading stroke neurologist at Cedars-Sinai Medical Center, proper body positioning can stabilize blood pressure and reduce complications before treatment begins. Avoid lying flat on your back. That position can worsen breathing difficulties or increase intracranial pressure. If you're too weak to move much, try to tilt your head slightly upward and rest your weak arm in front of you to prevent it from being trapped under your body. Keep breathing in that same 7-7-7 rhythm we discussed earlier. Your brain still needs oxygen, and your breathing is the only thing you can control until help arrives. Remember, survival in a stroke isn't about doing everything perfectly. It's about doing the most critical things in the right order. And this position could literally keep you alive until paramedics arrive. Number 7, avoid eating, drinking, or taking pills. This last step might surprise you, but it's one of the most important. When a stroke hits, never eat, drink, or take any pills, even if you think it might help. Here's why. Strokes often weaken the muscles that control swallowing. You might not feel it, but your throat becomes less coordinated. a condition called dysphagia. Trying to swallow water or medication can send it straight into your lungs, causing choking or aspiration pneumonia. According to the American Academy of Neurology, up to 65% of stroke patients experience swallowing problems during or immediately after an episode. Even if your symptoms seem mild, resist the urge to take blood thinners like aspirin on your own. Not all strokes are caused by clots. Some are hemorrhagic, meaning there's bleeding in the brain. Taking aspirin then could make things far worse. As Dr. Larry Goldstein from the University of Kentucky Stroke Center explains, without knowing your stroke type, self-medication can turn a survivable stroke into a fatal one. So until professionals arrive, stay still, stay alert, and stay empty. No food, no drink, no pills. Just focus on breathing and staying conscious. Bonus tip: train your brain before a stroke happens. The best time to prepare for a stroke is before it happens. Because when your brain knows what to do, your body follows faster, even under extreme stress. Start by practicing your emergency plan once a month. Just like a fire drill, walk through what you'd do if a stroke hit. Say the FAST signs out loud. Practice unlocking the door. Keep your phone in a reachable place at all times, especially when resting or showering. Next, strengthen your brain's backup wiring. Research from Harvard Medical School and the Journal of Cerebral Blood Flow and Metabolism shows that mental activities like reading, puzzles, or memory games help build neural reserves, extra brain connections that can protect you during a stroke. This process is known as cognitive resilience. Even 5 minutes a day of brain exercise, reading aloud, counting backward, or recalling yesterday's meals, keeps your brain alert and responsive. Pair this with daily brisk walks, good hydration, and foods rich in omega-3s and antioxidants, like salmon, walnuts, and berries. As Dr. Lisa Mosconi from the Weill Cornell Medical Center says, a healthy brain isn't built in crisis. It's built into daily habits. So train your mind, plan your response, and prepare your home, because survival starts long before the stroke ever does. Conclusion: a stroke can strike without warning, but knowing what to do and doing it fast can mean the difference between life and death. Every one of these steps is supported by real medical research from institutions like Harvard Health, the CDC, and the American Stroke Association. This video was created after weeks of study and verified medical research, but we can't include everything here. You'll find links to the full studies and expert references in the description if you'd like to read more. If you found this video helpful, please like, subscribe, and share it with someone over 50. It could save a life. And comment your age and location below so we can understand who our health community is helping most. Stay aware. Stay ready. Your brain deserves it.